Hi everyone, welcome back to your channel. I love pharmacology. In this session, let us learn about a very important topic, that is migraine. So, to understand migraine, let us see what do you understand by migraine. So, migraine is a specific condition where there will be a pulsatile unilateral headache. So, why there is a unilateral headache? Because of the dilatation of the cerebral vessels. Dilatation of the cerebral vessels will cause a stretching of the neurons or the nerve fibers around the blood vessels. So this will going to trigger the pain sensory nerve endings. Along with that, the recently recognized mechanism for the pulsatile headache is the release of the CGRP, that is calcitonin gene related peptide release will trigger the inflammatory mediator release. So CGRP being the principal mediator, it is responsible for the neurogenic inflammation. It is responsible for the neurogenic inflammation and also it is responsible for the vasodilation. So one of the newer target points will be your drugs which are targeting the CGRP. So next coming to the migraine attack. Migraine attack. So before going to that, so basically since the cerebral vessels are dilated, the main aim of these drugs will be to constrict the blood vessels, thereby it reduces the stretching of the nerve endings surrounding the blood vessels and also to decrease the CGRP activity. So migraine attacks can be classified into mild, moderate and severe based on the frequency of the attack. So mild to moderate migraine can be treated by the simple non-steroidal anti-inflammatory drugs like, so what are all the simple drugs which are available? So it can be treated with the help of the NSAIDs like paracetamol, ibuprofen, etc. Then in case of severe migraine attack, you need to go for a specific drugs which are pertaining to the migraine. So those drugs will be the ergot alkaloids, that is ergotamine, ergometrin, etc. and the triptans. So coming to the ergotamine. So ergotamine being the specific drug which can be used in the treatment of acute attack of migraine, especially the severe acute attack of migraine. So ergotamine will going to abort the acute attack of the migraine. Here you can use two forms. One is the oral or the sublingual, that is ergotamine can be used in the form of oral or the sublingual route, and dihydroergotamine is used for parenteral administration. So one of the specific very important thing you should remember is the caffeine will be added to ergotamine. So what is the reason behind adding caffeine to the ergotamine? The reason being the caffeine will going to increase the absorption of the ergotamine. You can decrease the dose of the ergotamine and also the caffeine will act as a powerful vasoconstrictor. Thereby the dilated cerebral blood vessels will be constricted. So the two reason why caffeine will be added to the ergotamine, the basic reason is it will going to increase the absorption of the ergotamine and also it will going to cause powerful vasoconstriction. So what are the side effects or what are the limitations for the use of the ergotamine? So one of the major limitation is there is increased risk of nausea and vomiting when you use the ergotamine in case of the migraine. Next coming to the very specific drug, that is the triptans, that is sumatriptan. So please remember guys, this is a very important question that can be asked in your exams as well as in any of the competitive examination like NEET, FMG, etc. So sumatriptan you can remember with S. S stands for it is selective serotonin receptor antagonist. With serotonin receptor antagonist 5-HT1B1D receptor agonist. Please remember it is selective 5-HT1B1D receptor agonist. It will going to cause vasoconstriction of the cerebral blood vessels. So it is a drug of choice to abort the acute attack of migraine. So if they ask which is the preferred drug for migraine or commonly used drug for migraine, the answer will be your a simple non-steroidal anti-inflammatory drugs. But if they ask for the drug of choice for acute attack of migraine, your answer should go for the triptans. So triptans are the drug of choice for to about the acute attack of migraine. So one of the advantage over the ergotamine is, so this sumatriptan is devoid of the vomiting. So it will going to cause suppression of the vomiting. So you will not have a side effects such as nausea and vomiting which were seen with the ergotamines. So this will not be seen with the sumatriptan. And also it has got the short oral bioavailability, as well as the short acting drug. So it is given subcutaneously. So all the features of the sumatriptans are will be starting with S. So it is selective serotonin receptor agonist, that is specifically 5-HT1B1D. So it suppresses vomiting. It is a specific drug of choice to abort the acute attack of migraine. It is very short acting and it has got some oral bioavailability, only little bioavailability, and it is administered through subcutaneous route. So two more things you should remember with respect to the triptan is we have other drugs like fravatriptan. So fravatriptan is a long acting triptans, whereas ziratriptan is a fastest acting triptans. So basically these two drugs, ergotamine and sumatriptan, should be avoided in conditions which are associated with ischemic heart disease, that is in case of angina, etc. Because these two drugs will going to cause vasospasm because of the contraction of the blood vessels, because of the vasoconstriction. This will going to hamper or alters the ischemic conditions. So next, moving on to the migraine with angina. Can we use this drug in case of migraine with angina? So please remember, so migraine, if it is associated with angina or if the patient is having any ischemic heart diseases, so both the drugs ergotamine and triptans are contraindicated because as we discussed, it causes coronary vasospasm, which will going to decrease the benefits in case of the angina patient by worsening the ischemic heart disease because of the vasoconstriction. So where all you should avoid the triptans? So triptans are contraindicated in case of ischemic heart disease, in case of pregnancy, in case of hypertensive patient, in case of liver as well as the renal disease patient. And very important you should note is you should never combine triptans or ergotamine within 24 hours of administration of each other. And in case of the migraine associated with ischemic heart disease or coronary heart disease, in such patients, so ergotamine and triptans are contraindicated. So what will be the other option which is available for administration of drugs in case of migraine associated with ISD and CAD? So the drug will be, I can go for the opioid group of drug, that is intranasal butorphanol. It can be used for acute severe migraine. So if the migraine is not relieved, you can go for the droperidol, and if it is not relieving, you can go for the propofol as a last resort. So coming to the migraine prophylaxis, very important. So when do you call it as a migraine prophylaxis? Whenever the attack is more than 2 to 3 per month, you require a migraine prophylaxis. So which is the most common drug or the drug of choice for migraine prophylaxis? So drug of choice will be your beta blocker, that is your propranolol. Apart from that, you can also use other group of drugs, many drugs. Please remember, this has been asked many times in your exams, and also it can come as your short answer questions for 3 marks or 2 marks or 1 mark, and viva also it is a hot favorite question. So calcium channel blockers you can use. We have flunarizine, diltiazem, verapamil, and the nimodipine. And you have a clonidine, that is the alpha 2 agonist, and you have methysergide, you have cyproheptidine, and tricyclic antidepressant like amitriptyline and imipramine. You have an anticonvulsant drug, that is the topiramate, and also you can use other anticonvulsant drug, anti-epileptic drug like valproate and a gabapentin. So you should remember ona-botulinum toxin A can also be used only if the headache is more than 14 days per month. More than 14 days per month, you can go with the ona-botulinum toxin A, and it has to be administered every 12 weeks, and it should be administered around the head and the neck. And one more is the candy certain, which is the ARBs. 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 So these are the group of drugs which can be used in case of the prophylaxis. That is the propranolol, calcium channel blockers, alpha 2 agonist, methysergide, cyproheptadine, tricyclic antidepressant. We have a anticonvulsant like topiramate, ona-botulinum toxin, and the candy certain. So how we can remember this migraine prophylaxis? So you can remember as a pot which is kept on the CM. So that will be the headache. So whenever you carry a pot for a long time on the head, what will happen to the CM? So CM will get a headache. So P stands for propranolol, which is a drug of choice for prophylaxis, which is a most commonly preferred drug for prophylaxis of migraine. So O stands for ona-botulinum toxin, T stands for tricyclic antidepressants, one more T stands for the topiramate, that is anticonvulsant. So C stands for clonidine, one more C stands for cyproheptadine, and one more C stands for candicertan, and M stands for methysergide. So basically, when we talk about in terms of the broader groups, so you have a beta blocker for the prophylaxis, you have a toxin that is ona-botulinum toxin, you have a tricyclic antidepressant, anticonvulsant, you have alpha 2 agonist, and the ARBs. So next, coming to the CGRP and its migraine. So CGRP, the calcitonin gene related peptide, is responsible for neurogenic inflammation as well as the vasodilation. So which will going to trigger the pain, due to vasodilation, neurogenic inflammation. So here the basic aim should be to decrease the CGRP release or to block the CGRP activity by blocking the CGRP receptors. So one such drug which will going to decrease the CGRP release is the 5-HT1F agonist. So they are called as detans. So here example, lesmedetan. So it is given orally for acute attack of migraine. On the other hand, to block the CGRP activity which is released, you have a CGRP antagonist. So these antagonist drugs will going to end with the drugs like Gpant. So you have a rimagepant, ubrogepant. So they are given orally again for acute attack of migraine. So 5-HT1F agonist, that is lesmedetan, as well as CGRP antagonist, that is the Gpants, they are given through oral route, and they are basically used for acute attack of migraine. On the other hand, you have got the monoclonal antibodies. So very important from the exam point of view. You have got erinumab, you have galcanezumab, you have fremanezumab, and we have eptinezumab. So these are the monoclonal antibodies which are available for the treatment of the migraine. So these are the newer group of drugs. So these are given through injection, especially through subcutaneous route, and it is used for prophylaxis of migraine prophylaxis. So monoclonal antibodies are preferred for the prophylaxis of the migraine, whereas the 5-HT1 alpha agonist lesmedetan and the Gpants are used for the acute attack through oral route. For prophylaxis, you will be using the monoclonal antibodies like erinumab, galcanezumab, fremanezumab, and eptinezumab. So coming to the summary, so which is the most preferred drug here? The preferred drug will be your what is the preferred drug? Yes, the preferred drug will be your a beta blocker. Preferred drug for a simple migraine will be your non-steroidal anti-inflammatory agents such as the paracetamol, ibuprofen, etc. So which is the drug of choice? So here it will be your non-steroidal anti-inflammatory drugs. So drug of choice for acute attack of migraine, what is the drug of choice? So please remember, drug of choice will be your sumatriptan. So which is a prophylactic drug which is most commonly used in the prophylaxis of migraine? That is your beta blocker, that is propranolol. Okay, which is the example for 5-HT1B1D agonist? So it is your sumatriptan. So which is the drug which is a 5-HT1 alpha agonist, that is detans, detans, which is used for acute attack of migraine and it is given through oral route. So Gpants are basically CGRP receptor antagonist. So the example will be your Gpant. So which Gpant? Rime Gpant and Ubre Gpant. And you have monoclonal antibodies. So you have a Erinumab, you have got Galcanezumab, Fremanizumab, and the Eptinezumab or the CGRP monoclonal antibodies. And which is the ARBs which are used for the prophylaxis of migraine? That is candicertan. Why caffeine is added to the ergometrin? To increase the absorption. One reason is to increase the absorption, and second reason is it is a powerful vasoconstrictor. So in CAD, that is coronary artery disease patient, so which is the drug which is preferred? So ergotamine as well as the sumatriptans are contraindicated. In such individuals, you can go for butorphanol, which is a opioid group of drug. So if you find this video useful regarding the migraine, please subscribe to this channel to get a more update on such topics in upcoming days. So guys, please remember, this is one of the high yielding topic you must know. It can be asked in your second year exams, it can be asked in your third year during ENT exams, and also it can be asked in the medicine also, as well as in all the competitive exams. So if you go through this video, it is a comprehensive view on how the migraine occurs, what are the types of migraine based on the severity of the pain, mild, moderate, severe, and what is the pathology behind it. We have discussed very briefly, and what are the drugs which are useful in the treatment of migraine as well as the prophylaxis of the migraine. And also we have discussed about the newer drug, that is the CGRP, those drug which will going to decrease the activity of the CGRP. Thank you.